Hello, I'm Dr. Kenyon Meadows, a board certified radiation oncologist. One of my favorite follow up visits in the clinic is when I get to sit down with the patient and show them a clean PET scan. These are powerful visits because a picture's worth a thousand words, and oftentimes the difference between their pre treatment and post treatment scans is so dramatic, I oftentimes don't have to say anything. A PET scan is a specialized type of imaging study. Like a CT or MRI, it gives us anatomic information, what things look like structurally, but also adds an extra and very important layer of information: metabolic activity. Cancer cells tend to grow much faster than normal cells, and because of that, they use more sugar for energy. During a PET scan, we give a small amount of radioactive sugar, and areas that are metabolically active, like many cancers, light up on the scan as bright orange yellow signals, which help us identify where active cancer may be present. There are some normal tissues like the brain and heart which routinely light up on the scan as well. This metabolic information is a critical part of cancer care as it helps your oncology team with staging, estimating prognosis, and deciding what treatments are most appropriate. For example, here's a patient with a fairly advanced cancer involving the throat. This patient was treated with curative intent, receiving 7 weeks of radiation along with chemotherapy. Even during treatment, it was clear that they were improving. Their swallowing became easier, and the pain caused by the tumor began to decrease. Typically, we obtain a follow up PET scan approximately 12 weeks after completing chemoradiation. Fortunately, in the majority of cases, I'm able to show the patients that the areas of abnormal activity have completely disappeared. PET scans are used across a wide variety of cancers, including lung, cervical, and prostate, to name a few. The example I've shown here represents a very clear, complete response, but there are certainly times when the results are not as clear and there may be the need for additional imaging or other tests. So it's very important to follow up with your treating physician soon after having a PET scan. I hope you found this video helpful. And if you have follow up questions or other oncology topics you'd like me to address, you can leave a comment down below. You can email me at questions@drmeadows.com or even text the number on the screen. Until next time, take care. Thanks.